If we look to this specimen, I'll find this is the pons sagittal section, the midbrain, and this is the medulla oblongata. This is the cavity of the fourth ventricle. And this is the aqueduct of Sylvius, or cerebral aqueduct. And here is the superior colliculus, and this is the inferior colliculus. It's very important, this colliculi, because they frequently presented in the practical exam. The superior colliculus and the inferior colliculus. And this is the aqueduct of Sylvius. This is the tectum of the midbrain, and this is the tegmentum of the midbrain. It's very important. Cavity of fourth ventricle, superior colliculus, inferior colliculus, aqueduct of Sylvius, tegmentum of the midbrain. If we look to the anterior surface here, this is the pons, and this is the middle cerebellar peduncle. This is the medulla containing the pyramid, olive, inferior cerebellar peduncle. And this area is the crus cerebri. The crus cerebri, or sometimes they call it cerebral peduncle, cerebral peduncle, or the crus cerebri. It is frequently also pointed at in the practical exam. So you have to identify it at many specimens. This is the front of the pons, medulla. This is the crus cerebri. This is the pons, medulla, and this area is the beginning of the crus cerebri. You have to identify it. If we look to this nice specimen, this is the pons, and this is the basilar groove for the basilar artery, and this is the basis ponti, and this is the middle cerebellar peduncle, and this is the basilar artery in its position. If I remove it like that, this is the crus cerebri, or sometimes they call it cerebral peduncle. If we look to this specimen, I'll find this is the interpeduncular fossa at the base of the brain. The fossa is made inferior by the crus cerebri, and anterior by, this is the optic nerve, optic chiasma, and this is the optic tract, and this is the crus cerebri, rhomboid-shaped fossa at the base of the brain. It's called the interpeduncular fossa. It contains the two mammillary bodies, and it contains the tuber cinereum and the infundibulum for the hypothalamus. And here is the posterior perforated substance for the central branches of the posterior cerebral artery. And here is the anterior perforated substance for the middle cerebral and the anterior cerebral arteries. And the circle of Willis, as you know, is the posterior communicating artery between the internal carotid and the posterior cerebral artery. The most important here is the optic tract, and the crus cerebri. This is mammillary bodies. They are not very important. Tuber cinereum is not very important. Posterior perforated substance is not also very important. This is the uncus, and this is the uncus. It is very important, this uncus. It does not belong to, it belongs to the inferior surface of the cerebral hemisphere that we discussed it. This is the hippocampus, and this is the uncus. You have to know it well, the uncus. And this is the inferior surface of the cerebral hemisphere. This is the orbital part, tentorial part, and this is the parahippocampal gyrus. and continues here the uncus. You have to know it well because it's commonly presented in the practical exam. The uncus and the parahippocampal gyrus. And here is the orbital part of the inferior surface of the cerebral hemisphere as we discussed. And this is the olfactory tract in the olfactory sulcus. And this is the olfactory bulb. And this is the rectus gyrus. All are not important in the practical exam, but just when you are going to study, so you have to be oriented with the anatomy. But the uncus is important. Parahippocampal gyrus is important. Here also parahippocampal gyrus is important. The uncus is important to know. Concerning the cerebellum is usually presented in the practical exam. And it should be presented in the practical exam. This is the cerebellar hemispheres, the superior surface of the cerebellum. It has an anterior notch here and posterior notch here. The two cerebral hemispheres are connected together by a middle line called the superior vermis. So if I put here in the middle line here, this is the superior vermis. Laterally here is the superior surface of the cerebellum. There is the fissure brimum or primary fissure on this superior surface, which divides the cerebellum into the anterior lobe of the cerebellum, anterior to this fissure, and the posterior lobe. So this is the primary fissure. This is the anterior lobe of the cerebellum, and this is the posterior lobe of the cerebellum. If we look to the posterior lobe of the cerebellum, we'll find another lobe, which is the folliculonodular lobe. If I remove it, on this surface, on the inferior surface, I'll find this area is called the vallecula. Wadi, حتة غويطة. And this vallecula, I'll find the inferior vermis. The inferior vermis has a nodule, a uvula, and the pyramid. The nodule connected with the folliculus. This is the folliculus, and this is the nodule. They form the folliculonodular lobe, which is the third lobe of the cerebellum. Cerebellum has an anterior lobe, posterior lobe, and the folliculonodular lobe. This is the inferior vermis. Is presented in the practical exam. The inferior vermis. On both sides of the uvula, I'll find the tonsil of the cerebellum. Very important in the practical exam. Very important, the tonsil, the inferior vermis. Very important also. The superior vermis is important. The anterior lobe of the cerebellum, and behind it, this is the posterior lobe of the cerebellum. But rarely, and we never choose the folliculonodular lobe at all, but we can choose the inferior olive, the inferior vermis. Its parts are not important to know in the practical exam, but this is the inferior vermis. This is the tonsil of cerebellum. Very commonly, the tonsil of the cerebellum is presented in the practical exam. Very, very common. And the anterior lobe of the cerebellum. I will find, if I put the needle in the middle line, so this is the superior vermis. And you have to say superior vermis. If you say vermis only, you will get half a mark. And if it is on the cerebellar hemisphere in the anterior part, this is the anterior lobe of the cerebellum. This is the anterior lobe of the cerebellum. This is another specimen of the cerebellum. and this is the inferior. It's not very well, like this is the tonsil of the cerebellum. This is the superior surface and primary fissure. This is the anterior lobe, and this is the posterior lobe. And in between here is the inferior vermis. It's not well dissected. If you look to another specimen here, we'll find this is the superior surface, and this is the superior vermis, and this is the horizontal or the primary fissure, and this is the anterior lobe of cerebellum. Inferiorly, this is the inferior vermis, and this is the tonsil of the cerebellum. Tonsil of the cerebellum. You have to know it well, because cerebellum is one of the specimen you will find in your practical exam. Stop it.